Welcome to the Liberty Home Care Podcast. Today we'll be talking about the CDPAS program with Mary Norton, Director of Patient Services. And the CDPAS stands for Consumer Directed Personal Care Services. Thank you, Mary, for joining us today.
Thank you.
Tell us a little bit about the CDPAS program. What does it entail?
Well, the CDPAS program is a statewide Medicaid program that provides an additional way for people to get home care services, where the consumer or the patient has more control over what they say, what they need, and how to direct their staff. It was set up geared primarily for the physically disabled and chronically ill, who kind of need help with just getting around, doing basic things like bathing and dressing and, helping out with meals or some housekeeping, that kind of stuff. And even some nursing services, because nursing kind of had a shortage, so they also could do some of the nursing tasks as long as the patient can direct the aide how to do that.
And it really helps the quality of life for these people.
Oh yeah, sure. They can stay at home versus having to go into a nursing home, or an adult care facility because they have nobody at home that can take care of them.
Right, okay. And what is the criteria to be a member of the program?
Well, they have to have Medicaid. A lot of your long-term care companies, insurance companies who are also Medicaid-based also can provide those services. Medicaid would set up a person that would come out to do an assessment, and they would determine the amount of hours or authorized hours that they could use, and then it would go to an agency where they could help get the client signed up for those services.
Great, thank you.
Mm-hmm.
And you did touch on some of the services and activities, but generally what would the aides that are hired, what would they provide to the members?
Well, like I said, some of them were the bathing and dressing, the personal care needs where they need assistance with this just to get out of bed, maybe even in the morning, to get into the bathroom, to get dressed for the day. They can help provide meals, make a breakfast, a lunch, or a dinner. Some patients, can't use the stove and maybe, have had burns and falls and stuff like that. So they could help them in terms of providing those services that the patient can't do for themselves anymore. But they're still trying to make the patient independent. And, they can still do whatever they can for themselves, but whatever little assistance they need, they would be able to do that. But they could go grocery shopping, they could run errands, they could do laundry, just things that we would do every day, at home that we don't even think about sometimes.
Sure, right. And can they administer medicine or some of that kind of medical type of...
They can do certain treatments in that, but it would be the patient that would have to teach them how to do it.
Okay.
So yes.
I see. Great. And how does the hiring process work? Who can they hire, and how does Liberty Home Care oversee that process?
Well, the consumer can hire anybody they want, other than a person who might be financially responsible for them, like say a spouse. They could hire their next door neighbor, they could hire their granddaughter, the friend, that lives 2 blocks away, that kind of stuff. And so they're the ones that are hiring those people. In Liberty, what we do is there's requirements by New York State that they have to have physical information in order to be a CDPAS aide. And those would be like a physical, your shot records, your TB testing. And Liberty maintains that for them every year so that they're up to date with those regulations.
Okay, great. So it's like a part-time job for others, but a full-time job?
It can be up to a full-time job. It depends on what the state authorizes in terms of number of hours. So they can work up to 40 hours a week. And they can work as little as 8 hours a week, whatever the patient has authorized and they want the person to work.
So it's like you said, it could be a relative or a neighbor, and so they're getting income, and they're also helping somebody they care about, so that the patient is getting the best of both worlds.
Yeah, definitely.
They choose that person.
Yeah, I mean, I'd much rather have a family member take care of me than a stranger.
Sure. Exactly.
Most of the time, we get along with our friends, our neighbors, and they're all willing to help, but if they need a job and they can't just come and help you, this may be the alternative to do both.
Oh, okay. And then the other thing was that you said the amount of days or hours would be determined by the medical severity, or the Medicaid would determine that for each situation?
Yes, they go out and they do an assessment, and based on that assessment, they determine the needs of the patient, and then it's up to the patient if they want to go through the consumer directed program, and those hours then would be authorized to the agency that would provide, the services that Liberty does.
And then Liberty as a whole, once the person is selected, they do the paperwork and the paycheck for the person?
Yes, we do all the paperwork necessary for New York State to enroll in this consumer directed program, and with all their medicals, and then we have them do like timesheets, or we have electronic verification that tells us what hours they put in for the patient, and then we verify that, and then we basically cut a paycheck for them.
And is it bi-weekly or weekly? What's the frequency?
It's twice a week. Every 2 weeks they get a paycheck.
Every 2 weeks, right?
Yes.
Just like most people, every 2 weeks.
Yes, sorry.
And is direct deposit available for these aids? Or
Yes,
it is.
it
Okay,
is.
Great.
Definitely.
And then you did mention, I just want to reiterate, there is one exception. It could be any relative except for the spouse or the person who's the financial provider.
Correct. Yes.
Right.
Yeah, if they have any financial responsibility for the patient, they cannot be consumer directed aid assistance.
Right, I see. Sure, okay. And then that's great. And what's the best way for people to learn more about the program and to talk to somebody to assess if they're eligible? If you want to know more about it.
If they want to give us a call at Liberty Home Care, our phone number is 716-274-5000, and just tell the person that answers the phone that you'd like to speak to somebody about the Consumer Directed Program. We have a couple of schedulers and coordinators that will be able to assist you and give you an idea of what you might need and how to get started in the program.
Excellent, thank you. And is there anything changing in 2020 with the program? It's still in the same form going
Yes,
forward?
it is.
There's
right
no
now.
new legislation to change it or anything?
They had some legislation going on in terms of how the insurance companies and that would be paid, but that has since been, right now it's still, there was a court case that we won. And so everything right now is going to stay the same. There's nothing that I know of it coming down, at least right now, that's going to change.
Okay, excellent. Thank you, Mary, for joining us today. And Mary Norton is the Director of Patient Services for Liberty Home Care, and Liberty oversees the CDPAS program, which is the Consumer Directed Personal Care Services program, the Medicaid-funded program that helps improve quality of life and take care of daily activities for members in the program. Again, the number is 274-5000, and also online, libertyhomecare.org/CDPAS for CDPAS, libertyhomecare.org/CDPAS. Thank you.